Greetings, it's good to see you all. My name is Whitney Mphangwe. I'm based in the Center for Global Health in Trinity College Dublin, and that's where I carried out this research that I would like to share with you right now. So, this study was supervised by Dr. Mairead Finn, who is also in the Center for Global Health in Trinity College Dublin. And as you see, this was an exploratory study where we wanted to find out the factors that have contributed to high levels of stunting, especially in under 5 children in a district that's called Nchisi, which is in the central part of Malawi. And something important to note about this district is that it is highly productive in terms of agriculture. So this is the location of Nchisi, and this is the map of Malawi. And as you see, it's in the central part of the country. And in this area, we really need to find out why stunting remains at 40%, which is even higher than the national level. Because food production is very good in this area, and there have been several projects that have been implemented towards food security, nutrition, and health. But the prevalence of stunting is even higher than the national level. So this study was qualitative descriptive in nature because we wanted to draw experiences and practices from the participants. The participants were sampled at 3 different levels, and that's at policy, health treatment, as well as household. So in total, we had 9 focus groups, and the interviews were in form of semi-structured. So the participants were able to relate their daily experiences and practices towards childcare. So after this data was collected, the data was analyzed using thematic inductive approach because we wanted the experiences in Nchisi to be the key and the center of the analysis. So the themes that came out were particular to Nchisi because the themes came from the data that was collected. And later on, the themes that emerged from this data were analyzed in relation to the UNICEF's conceptual framework of malnutrition. And as some of you might be aware, this conceptual framework of malnutrition that was developed by UNICEF has been used for decades in categorizing the causes of malnutrition. So these themes that emerged from Nchisi were also discussed in relation to this framework. So the findings revealed that the causes of the contributors of stunting in Nchisi can be grouped at those 3 levels of participants that were sampled. That is at household, health treatment, and at policy level. As you see, some of the issues are really particular to a specific level, but there are some others that cut across all the 3 levels. For example, if you note social norms and gender, although it seems to affect each of the levels, but they are cutting across all the 3 levels. So at the household level, there are social norms, particularly around infant and young child feeding, and those are the roles that men and women take in feeding and caring for young children. And also at the health treatment level, it was very obvious and particular how men and women differ in taking care of children that have been admitted in nutrition treatment programs. As well as at the policy level, it was clear how the difference in social roles, how it affects the nutrition and food security programs that are being implemented. So overall, what we can conclude from this study is that the contribution of the contributors of stunting in Nchisi agree with the conceptual framework, the UNICEF's conceptual framework of malnutrition, that the causes can be immediate, underlying, as well as basic. But something particular for Nchisi, we see how gender is at the center of the contributors to stunting. In the UNICEF's conceptual framework, we see that gender usually appears to be at the basic level, but the data that came out of Nchisi, it was clear how gender disparities right at the household contribute to the levels of stunting. For example, we see at the immediate causes how the differences in authority, how men oversell the produce and then they get the income and they don't spend it on nutrition, and then the women don't control family size and they don't control when children are born, and how overall this affects the dietary intake for the children. And also at the underlying causes, we see how disparities in decision making, and that is probably about what to produce, how much to produce, and then how much to keep, how much to sell, and what to utilize, and how any issues that are affecting that arrangement end up in gender-based violence. And also, when we came to the care and feeding practices, it was clear that there's no male involvement in nutrition activities, as well as including expenditures that are made on food and things like that. And even at the basic level, it was clear from the policy level focus groups, they related how difficult it is to implement nutrition and health interventions because of the gender and social norms that are particular in the communities, which display that men have more control and authority over family resources. So from these findings, this study recommends that interventions that can be used in Nchisi to address stunting agree with the Malawi government multi-sectoral national nutrition policy, which is currently in use, that the solutions and the interventions must be evidence-based. For example, maybe using studies like these and the others that have also been published in Nchisi. They have to be multi-sectoral, it has to be cost-effective and area-specific. And these are the references. Thank you very much.